I'm Michael Hopkins, and I just had pituitary macroadenoma removed, brain surgery, neurosurgery. A year and a half ago, I had cancer, and in my follow-up cancer treatment, was assigned an endocrinologist, Dr. Aronowitz, and she was very thorough and did a lot of different work along the way. And as of about a month or so, 2 months prior to the surgery, she noticed that my endocrine levels, my kidney levels were off. She called me up on a Wednesday and she says, "Hey, I spoke with the neurosurgeon already, and you need to call him as soon as you hang up with me."
So Michael was sent to us by his endocrinologist. They noticed that some of his hormone values were a little bit off, and so they got an MRI of the brain which showed this very large pituitary adenoma. Pretty common tumors, but in the vast majority of cases they're tiny and really not of much clinical relevance. As in Michael's case, they become very large and start putting pressure on important structures.
Then he showed me on the screen the size of the mass. It was 3.1 by 2.5 centimeters, and just really compressing my pituitary, compressing my optic nerve. And he says, you very well could wake up blind one day, permanently, temporarily. And I'm like, well, that's not good for business.
So I work with an ear, nose, and throat doctor who goes through the nose, and then they get us into what's called the sphenoid sinus, which is this air space right in front of the pituitary gland. And you're right there. And then you basically just remove the tumor through that angle. With anything, these things have a small chance of coming back at some point in the future, but in the vast majority of cases, once you take it out, that's it.
Memorial different is that their physicians are able to concentrate solely on their practice, solely on their patients. Better outcomes make better facilities, better hospitals, better employees, better people to work with. And me as a patient, I couldn't have been anywhere else.